This is known as class 2 hypovolemic shock. So, in order to know that this patient is in shock, you have to touch him, examine him, and know in fact that this increased sympathetic drive is going to make him have several changes in his body that you have to pick up. If you don't pick up, if you don't treat him now, what is going to happen to him? Yes, he will move to class 3 shock. Class 3 shock, BP will drop below 90 over 60. Why is it we don't wait until the BP drop over 90 over 60, then we treat him? We have to treat him when he's compensating. Why is it when the BP drops, it's too late to treat him? Anybody? When BP drops, sometimes the organ damage is already starting to occur. Okay? But most importantly, you know why they die? When the blood pressure drops, your circulation becomes slow. Correct? Correct or not? Your circulation becomes slower. When your circulation becomes slower, your platelets start high-fiving each other. Hey bro, I haven't seen you before, high five. Alright? Yes, they come closer, bro, the bro fist, bro hug, bro high five. So they start clumping unnecessarily. When they start clumping unnecessarily, what happens? Clots are supposed to form where the laceration is. But now, because the circulation is so slow, the clots are being formed elsewhere. And later, when the place where the clot is really needed, suddenly you see there's no more platelets and coagulation factors. All already used up unnecessarily elsewhere. He will start bleeding profusely. And this is called as, I'm sure you've heard it before. It is considered the bane of emergency. Disseminating intravascular coagulopathy, DIVC. Yes. If he develops DIVC, 1 out of 2 patients will die. So if you allow him, if you don't pick up that this blood pressure is not normal for him, and that he's in compensated shock, you don't pick him up at that time, he's crying for help, and you miss it, his blood pressure drops, most likely he's going to die. And it has happened before. Many a times it has happened before. Okay? Medical personnel is unable to detect that he is in compensated shock. The sympathetic is still able to compensate, unable to pick up that time, unable to correct the loss that has happened, progress and die. Crazy, right? So you are expected to detect at that second stage. Now, why is he so agitated? Anybody? Why is he so agitated? Okay, I'll ask you one question. Have you been angry before? You have been angry before, right? Of course you have been angry before. If you say you have never been angry before, can only mean one thing. You're not from this earth, right? You're an alien. Okay. When you are angry, have you said and done things that you have regretted? Oh no, I have good self-control. I am the monk level. Come. I got ways I can make you angry. Okay? Alright. Just kidding. Alright? Okay. So, correct or not? You become somebody else. And after your anger resides, they'll be wondering, oh my, why did I even do that? How on earth was I even capable of doing that? You know, people when they're angry, they're capable of murdering someone. Very gentle, calm, mild-mannered, suddenly end up murdering someone when they're angry, end up going to jail for the rest of their lives. Because of that one moment of fit of anger. Why does this happen? Do you know, when you are angry, you have increased sympathetic drive. When you have increased sympathetic drive, what happens? Your frontal lobe is inhibited. Frontal lobe is where your behavior, inhibition is all, you are defined by your frontal lobe. Without your frontal lobe, you are good as just as an animal. Because animals don't have a developed frontal lobe. We are human beings because of our amazing frontal lobe. So developed, gives us a personality, behavior, the ability to comprehend. But when sympathetic activates, especially when you're angry, unnecessarily sympathetic gets activated, you lose all judgment. Because when fight or flight, when a bear is running after you, okay? A bear is running after you. Are you going to stop and think, maybe the bear is just coming to say hi? Or maybe he's just running, after me, after something behind, I might as well just stay and then let's see what happens, Are you going to reason things out? There's no time for reasoning, my friend. There's only time to run. Or if you're brave enough, stand and fight the bear, if you're Vladimir Putin, okay? Alright. So I don't think you will choose to fight, okay? You will run. Because when it comes to a situation like that, you have no sense of judgment. It's straight down to primal response to fear. It's either you fight, or you flight, or you become food. Okay? Now, the same thing happens here. When somebody is in hypovolemic shock, they have increased sympathetic response, correct? That increased sympathetic response puts him in an angry state. His frontal lobe is inhibited. He becomes someone else totally. He starts screaming to you, being agitated. Unfortunately, some people don't pick this up. They think that he is crazy. Let's refer him to the psychiatrist. When actually he is crying for help because he's in shock. You understand? So that is why what I'm trying to tell you today is that having knowledge how the circulation works, what are the classes of shock, what happens at each stage when you lose blood is very important. Okay? So what I did at that particular time, I knew something was wrong. So immediately I have to examine him. When you meet your friend for the first time, you come to first year, right? You met a friend, right? What is the first thing you do? You meet somebody for the first time. Or you're antisocial, you don't believe in friends. What's the first thing you do? You say, hi, how are you? I am Ariff, very nice to meet you. Alright? Okay, it starts with a handshake. What is so beautiful about this handshake? Or this nod or warm smile? The first time when you meet somebody, you shake his hand, you form a bond. You form a bond. And this bond sometimes can last a lifetime. Alright? Because of, they say because of hormones like oxytocin, dopamine, blah blah blah, alright? It becomes even wilder, it's from the opposite sex, okay? But okay, so I won't say anything about it, alright? I'm not going to comment, okay? Alright. But you form a bond. Same thing when patient comes. Sometimes you see them put to the monitor, put to this, put to that. You see all sorts of imaging. I'm pretty sure you're exposed to imaging by now. Do you know this imaging and all these machines can't replace you as a human being, making a connection with another human being? When you touch him, you will already know somebody is wrong. Something is wrong. Okay? When you touch, believe me or not, you can know that this patient is having the touch of death. Seriously. You touch him, you know that he's dying and you need to save him. And at the same time, when you touch him, you form a bond with him, he knows that he's in safe hands. That is how important. That is why we always say, human touch. Talk to them. Empathy. Make them safe. Feel them. Give them comfort. But remember, doctors always have hidden agenda. While touching them, I'm also examining him. I know that he is I will know that I can pick him up if he's in compensated shock. How? I feel for the pulse. Do you know in class 2 shock, the pulse will be very weak. He will have cold clammy peripheries because all the blood has gone to central circulation. His capillary refill time will be more than 2 seconds. All these are clues that will tell me that he is in compensated shock. I need to do something immediately. His mental state is affected because of poor cerebral perfusion. He's tachycardic because of increased beta-1. He is tachypneic. He's breathing rapidly because of increased sympathetic response. His blood pressure is normal because he's compensating. He is not passing out any urine since we put him on the CBD. So, because of that knowledge I had on compensated shock, class 2, exactly what happens to him, I picked up that he has already lost 3 pints of blood. So you know what I did? I called for blood. I said, put blood immediately. The moment we put blood, you know what happened? He came back to his senses and he actually turned around and said, thank you. I really thought I was going to die. Seriously. And how did we save him? Is it because you're a rocket scientist? No. Is it because you're gifted to save people? No. It's because you have applied what you have learned. And because you touch him, you have the human touch, plus the knowledge, you put it together and you save this life. Alright? And are you capable of doing it? You are very capable of doing it. But, now do you get my point or not? Why is it's important for you to learn all that boring equations of cardiac output, what is it, MAP is equal to cardiac output atypia, cardiac output is equal to systolic transducer. Okay, we have the baroreceptor, this baroreceptor function blah 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 blah, and then sympathetic will cause your islets to blah 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 blah, and blah 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 blah, and go on. Alright? But, you need to know how sympathetic is. When somebody has increased sympathetic output, how will they present? This knowledge is very important, because one day, you will be able to detect things that other people can't detect, and you'll be able to save the patient. And mind you, in this profession, one of the biggest gifts that we have is the ability to bring somebody from the brink of death and help them. But at the same time, with great power comes great responsibility. Okay? If you refuse to learn, if you refuse to accept this knowledge, if you refuse to apply this knowledge, or you refuse to think when somebody comes, you expect everything to be handed out to you, you expect everything to be served, you expect all patients to come as symptoms served on a dinner plate, alright? Then you are in the wrong field. Because in this field, you must learn the capability of applying this knowledge, but at the same time, having the empathy to do so. So, are you all still following your dreams? Yes, I believe. I truly believe. Every one of you are capable of greatness. Each and every one of you, especially the backbenchers, you know? Especially the backbenchers. Always the backbenchers will be the most successful ones, you know? Alright. Each and every one of you is destined for greatness. You just don't see it yet. Alright? When you read physiology, appreciate. Start opening Google. Find out what happens if things go wrong. You always learn what's normal. It's always good to learn what if this cardiac output drops. In what cases it drops. Let's see some YouTube videos. What happens if cardiac output drops? They said hypovolemic shock. Come, let's go Google and see. You see, you have the wonder of internet in your fingers. My time, everything was, my time, I feel so old. My time, everything was dictionaries. We used to run around with the Stegman's dictionary, Netter's dictionary. We used to develop strong biceps because of all the books that we used to carry. Alright? But now, you have the internet. And how are you going to explain to your great-grandfather, alright, that you have something that you can just search for knowledge instantaneously, and it's being used to see cat videos? Repetitively. Okay? So you have the knowledge in your fingers. Start exploring. Start exploring. When you learn to make things interesting, find out how things go wrong. Find out how. Ask the lecturers. You know, the beautiful lecturers behind us, together in this room. We are all dedicated for only one thing. To make you learn, to give you the joy of learning. Ask them. They have years and knowledge of experience. Ask them, they will put things into perspective to you. Alright? Learn to appreciate the beauty of medicine. Why? When you learn to appreciate the beauty of medicine, then you will be able to save people, and you will be able to apply this beautiful knowledge. Alright? And make this community a better place to be in. That's how important each and one of you are. Alright? Okay, now, at the same time, when he recovered, suddenly his abdomen distended. Okay, his abdomen distended. So we did a scan, we saw fluid inside. So he needed to go to the operation theatre. Who is in the operation theatre that's going to receive him to cut him open and to fix whatever organs are severe? The surgeon is going to be there. They are also amazing people. Surgeons who work tirelessly around the clock. What knowledge do you need to see what organs are severe? How to repair the organ? What knowledge do you need? You need knowledge in anatomy. This is where applied anatomy is very important. You need to know the structure of the liver. You need to know the structure of the kidneys, where it lies. You know, they always tell you, oh, you know, the liver is here, the blood supply is here, the bile is here. What happens if something goes wrong? The liver, mind you, has got the richest blood supply. If something goes wrong, the patient can just lose blood and die. So where is this blood supply coming from? From which vessel the main supplies are coming from? How are we going to repair this vessel? When you learn anatomy, please always find out what happens when something goes wrong. Now, let's go to the next interesting part. Okay, so I hope physiology, you all get to see the big picture now. When you learn, find out how things go wrong and find out how to apply that physiology so that it doesn't become so boring. Alright? Understood? So if you learn, like, say, what are the boring topics in physiology, for example? Give me an example. Hormones. Is it? Come again? Hormones. Endocrine hormones, right? Hormones are freaking interesting. I tell you, you study hormones, you cannot sleep for a few days. It's that interesting. More interesting than the new Transformers that's going to come out. Why? Because you need to know how the pancreas works, how insulin comes out. If this insulin is not there, how the patient dies because of this lack of insulin. How important insulin is, where is it secreted from? If it's not secreted, unfortunately some people, the beta cells is destroyed by viruses. What happens to them? They die. How they die? Because when patients come to you, endocrine is so important because sometimes they come with so many different symptoms. You need to know, could this be a guy with low levels of insulin or no insulin? He's presenting like this. So start relating today. See, it takes longer time to study, yes, but you will appreciate it. Start seeing what happens when somebody doesn't, Google, when somebody doesn't have insulin. See videos, see what happens. Oh God, really? Like this? Oh my God, I really study, I have to study insulin. Come on, people are dying because got no insulin. Over dramatization, okay? Alright, so please, learn to apply. Because physiology, when it's applied, is beautiful. Seriously, medicine is not science, it's an art. It's beauty, alright? Exploring into the marvel of how the body works. People always say the universe starts from within us, correct? So explore your body first. Explore how things work. Apply, see what happens when things go wrong. And I assure you, you will find medicine one of the most beautiful things that you can learn, right? Now, anatomy. People dread anatomy, correct? Do you all dread anatomy? You all love anatomy. Okay, then I can stop the class. Okay. Alright. People dread anatomy. Why? Of course, if you learn it like this. Ulnar nerve, cause and relation. And then, okay, oh no, few days is my exam. How am I going to learn about ulnar nerve? Okay, no mind. I just memorized this. The ulnar nerve is derived from brachial vessel. Okay, ulnar nerve. Okay. Then, when the exam comes, you will just go and vomit out. And then, the next day, you have a hangover and you forget everything. And then when the time comes, when you become a houseman, the specialist, orthopedic specialist asks you, what is the, tell me the cause and relation of the ulnar nerve? You'll be like blank stare. When did I even learn about ulnar nerve? Alright, true? True? Yes? Okay, I was also lost on how to learn anatomy. I had a very good professor called Prof. Ma. He was an anatomical professor, a neurosurgeon turned anatomy professor, alright? He was amazing. He taught us how to learn anatomy. And you know what? Anatomy became a beautiful subject under him. So beautiful. Am I being too artistic here? Alright. Alright, please, huh? Okay. It's not a nerd moment, huh? Alright. It is very beautiful. How exactly do you learn anatomy? Let me share with you. Instead of memorizing this, remember, one picture speaks 1,000 words. Anatomy should never be learned in words. If you learn in words, something is wrong. If you memorize, something is wrong. Physiology, anatomy should never be memorized. Alright? All the basic sciences should never be memorized. You should understand what is going on. Alright? So for anatomy, the proper way to learn is you remember the picture. When you recollect, when you need to remember for the exams, you are recalling a diagram rather than words. How the vein, how the nerve is coursing beautifully. And then you see everything in your mind. And then you write down and you become one with the ulnar nerve. How you achieve this enlightened stage? Very simple. You see the picture. Oh, now you have the anatomy models, right? You can actually see and appreciate. How? It starts from the lower root of the brachial plexus. Okay, C8 and T1 from the lower root. Okay, and then it comes up beautifully. Alright? It starts its journey in life. And then it goes down to the posterior aspect of the medial epicondyle. Why is it named condyle? Condyle, for your information, is named after a Latin name called knuckle. Condyle means knuckle. Any parts of your bone that looks like a knuckle, they name it condyle. Epi means what? The outer layer of the protuberance. So epicondyle means the outer part of something that looks like a knuckle. Right? Because it's medial, they call it medial epicondyle. So it passes posterior of the medial epicondyle. There is a problem there. When you learn anatomy, you should also learn what happens if something goes wrong. You see, when you put your arms for a long time, then you suddenly feel the current, correct or not? You felt the current. Come on, don't tell me you never felt it before. You accidentally bang your elbow, suddenly you feel some current shooting. Correct or not? Why it happens? Because the ulnar nerve is at the posterior of the medial epicondyle. It's so vulnerable to damage. You bang a little bit itself, you already feel some current. Imagine if there's a direct impact. If a car comes and hit, or motorbike comes and hit, what will happen? When you have a fracture there, the ulnar nerve is easily severed here because it is exposed. That is why when someone comes with a claw finger, or you see when someone comes with a claw finger post MVA, you know that the ulnar nerve most likely could be severed near the elbow. Why is it called ulnar nerve in the first place? Ulnar means elbow. Because it is very prominent near the elbow, they actually named it after the elbow. Ulnar nerve. Ulnar means elbow, according to Latin. Alright? So now, because of that, it's very significant here. So when somebody comes with a claw hand, you suspect there's some damage, then what you actually need to do a X-ray there. Because you know most likely something is wrong with the elbow. Understood or not? How you apply this knowledge? Alright. Now, when the ulnar nerve keeps traveling, it now pierces what does it pierce? Flexor. It pierces two muscles, two beautiful muscles. One originates from the humerus and one originates from the where? Okay, never mind. Okay. So you have the flexi carpi ulnaris. It pierces both of the heads of the flexor carpi ulnaris. Where did flexor carpi ulnaris get its name from? Why is it named flexor? It's for flexing, right? It's in the flexor surface for flexing. Good. Why is it named carpi? Wrist. Carpi came from the word carpus, means wrist. And ulnaris. Why? It is supplied by the ulnar nerve because it pierces and supplies the flexor carpi ulnaris. Okay? And then it starts moving through the anterior forearm. And then in the wrist, where does it pass? It passes anterior to the flexor retinaculum. Why is it named flexor retinaculum? Retinaculum, for your information, came from the word retained. Why is it called retained? You see, the flexor retinaculum is not a muscle, but it's a fibrous band that holds all the tendons together. You know, it retains all of them together. That is why it is, and because it's at the flexor surface, it is called flexor retinaculum. It holds all, because there's so many tendons coming in, correct? There's so many tendons coming in, which is supplying the wrist and the hand. So because of that, it holds all of them together and stabilizes them. It's a band that holds all of them together. So that is why it is called retinaculum, something that retains all of them. Flexor retinaculum. It goes above. So, because it goes above the flexor retinaculum, when you have any problem with the carpal tunnel, is the ulnar nerve involved? It does not get involved. But who gets involved? Because the median nerve goes into the carpal tunnel. Any problems there, median nerve will involve. Ulnar nerve will escape because it's above. Understood? Then when it goes into the hand, it gives superficial and deep branches. And the superficial and the deep branches will supply the cutaneous and the muscles. And it supplies the one half of the medial side of the fingers and palms, as you can see in the picture. Did I memorize all this? I learned this ages ago. Okay? Dinosaur age I learned all this. Alright? But why can I recollect? I was not recalling, okay, I was not recalling the words. I was recalling the image. The image will be there forever. It's very difficult to forget the image, alright? Especially your girlfriend's birthday, never forget, please. Okay? Capture the image and always remember, alright? Okay, so now, when you study anatomy, this is how you study. Find out the picture, get the picture, see how it works. Don't memorize words. See each and every structure and what is the clinical significance behind it. Why is it in anatomy they ask you to study this? Right? You don't have to study everything. They say, carpal tunnel very important. Carpal tunnel very important. Why? Because some patients can come with entrapment syndrome. What are the symptoms they present with? How do you relate it with the anatomy that you just learned? Understood? Okay? So, can we learn anatomy this way now? And another very important thing, don't forget, certain structures are named after certain people. Like for example, the ulnar nerve passes through a canal known as the Guyon's canal. Find out who Mr. Guyon is. Do you know who is Mr. Guyon? No idea, right? Never tried, never looked, right? Guyon, Dr. Guyon, is a urologist. He practiced in France during the early 1900s. He was doing urology. He had nothing to do with the hand. But he was the one who discovered the Guyon's canal, and they named it after him. A urologist who had nothing to do with the hand, he found it and named it. And not only he has the Guyon's canal, there's also such a thing called Guyon's sign, where when you palpate the kidneys, if it's bloatable, it's also called Guyon's sign. Did you know? You know? These are the small bits and interesting things that will make you, because you see, your memory needs something to hook on. Images, names, something particularly interesting. So when somebody says, what is the name of the canal that the ulnar nerve passes through? You think, hey, who are? That urologist from France. Ah, yes, Mr. Guyon. Guyon's canal. Alright. It's not too late, right? Still got time to run this way, isn't it? Yes, it's never too late. Okay? It's never too late. So now, okay, we have come to the end of our session today. So please tell me that you will go back with some knowledge today, some change to your approach in learning basic science. Yes or no? Yes. Yes. And I assure you that this battle of sleepless nights, going to the OSCE only to forget whatever you have learned, alright? Okay, this constant battle of learning, it will come to fruit one day. And that one day, when it really matters, you will be able to apply this knowledge and help somebody. And what they say, this world is round. Whatever goes around comes around. You help somebody one day, another day it will come back and help you. There's a very nice story about a pediatrician who saved a preterm baby. Alright? He went all out and saved this preterm baby, and this preterm baby survived. Then, many years later, the pediatrician was caught in a burning car. And he was rescued by the fire rescuer. And you know who was the rescuer? That preterm baby that he saved. That's how amazing life is. What goes around comes around. All the good you do will come back to you. All the evil you do will also come back to you. Alright? So please, in your position, you are capable of doing so much good. And each one of you here are capable of greatness. Never ever doubt yourself. Because this is only your stepping point. One day when you become consultants, you will turn back and say, yes, I've always been on this path. I just need to go through it, enjoy life as well. Learn to go out with your friends, exercise, see movie, play games, at the same time, learn. Learn to marvel at the beauty of life itself, medicine included. With that, thank you, ladies and gentlemen.